What message would you give to women undergoing treatment currently?
Not only being told that you have cancer, but you are bravely fighting, every day, waking up and saying, I'm not giving up, I'm not giving up. So even if it feels like at this moment, you are facing so much difficulty, you have to keep on having that strength to go through every day, moment by moment, finding the strength within yourself and walking the journey until you reach the very end. So breast cancer is an abnormal growth of cancer cells in the breast. And because it is abnormal, it has the potential not only to invade the breast tissue itself, but also to spread to the local lymph nodes. And if left unchecked or untreated, it can also spread to other parts of the body like the lungs, the liver, the bone, and also eventually the brain. If the patient is on chemotherapy, some of the medications that we give can cause quite bad nausea. So we try to manage those side effects. And then because of the surgery, the patient can also have things like lymphedema, where they have like swelling of the arm. So there are certain things that we need to offer to the patient because of that.
Welcome to Med Talk, brought to you by Cospharm. My name is Basibona Pumusa, and I'll be your host for today. It is October, Breast Cancer Awareness Month. Today, we want to go a little bit deeper into life after diagnosis and the journey of healing in general. Joining us today is a very, very well-decorated doctor of ours, based in Sidileja from Hope Oncology. Dr. Bunga, welcome and thank you for joining us.
Thank you for that excellent introduction. So as Basetsana rightly said, my name is Dr. Antonia Bunga. I'm the director of Hope Oncology, and we are based at Sidileja Private Hospital, where we provide chemotherapy and immunotherapy to not only breast cancer patients, but a wide array of cancers. We also treat cancers like leukemia, lymphomas, prostate cancer, and many others. We also provide radiotherapy to our patients, and these services we offer from Haberoni Private Hospital and also at Village Oncology. So, that is the basis of my work.
Thank you for shedding light on our background. So let us dive right into it. What is breast cancer, and if you could at least highlight some of the causes of breast cancer?
Thank you for that good question. So breast cancer is an abnormal growth of cancer cells in the breast. And because it is abnormal, it has the potential not only to invade the breast tissue itself, but also to spread to the local lymph nodes. And if left unchecked or untreated, it can also spread to other parts of the body like the lungs, the liver, the bone, and also eventually the brain. So you asked about the risk factors as well.
And the causes, yes.
So there is no particular cause that has been identified, but indeed there are certain risk factors. And so there are some standard risk factors, then others like environmental, lifestyle risk factors, medications. So if we look at the standard risk factors, we're looking at age, mostly like women above the age of 50. Sex also has a role. Women are more commonly affected. There are also lifestyle factors like smoking, excessive alcohol, and also weight gain. So people with a poor diet, high in fat. So these are the risk factors that we are looking at. Also medications like hormone replacement therapy. If you take it for an extended period of time after menopause, over 5 years, then you're more at risk. So there was a suspicion that oral contraceptive pill was a risk factor, but that has not been proven.
Okay. Yeah. Thank you, Doc. Could you walk us through how breast cancer is diagnosed and perhaps why or how early detection is important in a patient's journey?
Yeah. So, yes, indeed, early detection is important, and it starts with breast self examination, which I recommend for all women. And following that, if a lump is detected, so a patient can seek care at a health facility. So, if we're looking at a clinic, the nurse practitioner could do something called a clinical breast exam, and from there she can refer to the doctor, who will then order certain tests like mammogram, and after the mammogram it can be confirmed that um, there's a highly suspicious lesion of breast cancer. Then the patient is usually referred to a surgeon, where core biopsy is conducted, and so a sample of that lump is sent to the laboratory, and that usually confirms that there is invasive cancer. And following that, the patient can have a variety of treatment options available to them based on those findings.
Could you please elaborate more on those kind of treatment, the options that the patient has after confirmation of breast cancer?
Yeah, so if it looks like it's early breast cancer, then there's an option to either remove the lump with a margin around the tumor, or to also remove the breast completely. Although removing the breast completely can have psychological implications on women, so that's why we recommend early detection, so that we can try to preserve the breast more, to try and deal with the long term effects. If we look at the femininity of a woman when they undergo treatment for breast cancer, the hair of a woman is so important to her, so she loses the hair. Then the breasts of a woman are also important to her, so we want to try and conserve, the normal appearance of the breast as much as possible.
Is there by any chance potential of using both two or more treatment options at the same time, or is only one after the other?
So usually it is one after the other. So it can be something given before surgery to try and shrink the lump, or it can be given after surgery. And I'm talking specifically about chemotherapy. And then radiotherapy may or may not be given. So sometimes, yes, it could be just two treatment options. Sometimes it could just be surgery, which just takes care of everything. But that is usually if the lump is extremely small, like less than 0.5 centimeters. And the chance of us finding such a small lump is very rare. So those are the problems that we face. That's why we are so um, uh, pushing people to do early detection. Yeah.
Doc, treatment may conclude,
Yeah.
but we are well aware that recovery also has a need for some sort of support.
Yeah.
Could you elaborate on those kinds? Could it be emotional, physical support to help improve the patient's healing journey?
Yeah, so that is very important. So, like when I consult patients, I try and encourage them to always come with a family member or a friend, someone that they're close to give them support. Mostly because when a cancer patient initially is diagnosed with cancer, so in their mind, they're only thinking about that word, and they're thinking, that maybe life is now looking like it's not expanding, but more like contracting. And so it brings about a lot of anxiety in the patient. And so even when I'm speaking to the patient, they're not hearing much of what I'm saying. So when they have somebody to support them, that person who's supporting them listens more carefully, because they don't have the pressure of being diagnosed with cancer, and they offer a lot of support. And I also encourage the families to allow patients to just feel whatever they're feeling. If it's, if they're going through a period of denial, because patients can go through that, where they don't want to accept the diagnosis. And so it really helps when the family is there, not to judge or to force or to do anything, but just to lend a listening ear and wait patiently for the time where the patient can possibly accept the diagnosis and then move forward with treatment to cure the cancer.
And then comes the matter of lifestyle. What kind of impact does lifestyle have on both treatment and recovery of a patient?
So a patient may have work commitments, may have a poor diet, may be a smoker, may be a drinker. So these are some of the things that we encourage patients to try to change. If they're heavy drinkers, try to reduce the drinking and eventually stop. And also, if you're a smoker, try to look for ways to stop smoking. And there are many treatment options available to stop smoking. For example, using the gum, Nicorette gum, and there are other drugs that doctors can give if patients are able to stop smoking for a certain period of time to prevent the patient from restarting smoking.
So basically, the do's and don'ts to breast cancer.
That's right. Yeah.
Thank you, Doc. What kind of follow-up care or management? This now concerns survivors post-treatment. How do you manage your patients after that? Do they go home, that's it? Or do they have to keep on coming back, checkups and the likes?
So, the management of breast cancer patients, so there's management during treatment. So, if the patient is on chemotherapy, some of the medications that we give can cause quite bad nausea. So we try to manage those side effects. And then because of the surgery, the patient can also have things like lymphedema, where they have like swelling of the arm. So there are certain things that we need to offer to the patient because of that. And then some of the drugs can also cause like heart problems. So, prior to doing chemotherapy, we do some tests to ensure that the patient can handle the treatment. And then we do repeated testing to ensure that even after the chemo, certain organs are still functioning, maybe not as well, but they're not failing to do their function.
Yeah. We can agree that breast cancer patients do need support in their journey to healing, right? Yeah. So how do you, because earlier on you spoke about family, for example, how can communities help empower those women, help them integrate back into community after that?
So, we recommend with their lifestyle, like say a woman has got children who need to be taken to school. Communities can come together and see how they could help with that, so that the woman who maybe was taking the kids to school every day, she just needs to rest from doing, certain things like that. So that's the kind of support that you could offer to a cancer patient, real practical support, while she's trying to get back into, her life after being treated for cancer. And, there's a lot of strain on women, like the physical strain of undergoing cancer treatment. You'll take up to, it's not a linear thing, like to say, okay, she's finished treatment, yes, she's going to get better, and it's, that way. It's healing is not like that. It could go up one day, down one day, very messy, and then, slowly there might be some progress. And it can take up to a year for a woman to completely recover. And that is just the physical strain. Then we're looking at the emotional strain as well. First of all, being diagnosed with cancer, and then to have the strength to emotionally go through all this while the demands of being, a woman of the house still on her. That could take up to possibly 2 years just to deal with, whatever treatment the patient has gone through. So, a family can really support a woman emotionally and just, hold space to whatever she's going through. She might be moody, she might be angry, she might, feel a lot of fear. So it really helps when families give a woman that opportunity just to be.
Extend to the workplace. Would you agree?
Absolutely. If a woman has, workmates also, it would help if she could, try to do maybe like mornings only, and when she feels that she can't, um, continue the whole day, you could offer something like remote work, where she could go home, rest, and then possibly work from home. So these are the practical ways that even, workplaces can support women.
So, doctor, what message would you give to women undergoing treatment currently? Women struggling to see life beyond breast cancer, women struggling to see life beyond and after healing.
The message of hope that I can give to women who are undergoing treatment currently is, you are a survivor, and you have gone through, not only being told that you have cancer, but you are bravely fighting, every day, waking up and saying, I'm not giving up, I'm not giving up. So even if it feels like at this moment, you are facing so much difficulty, you have to keep on having that strength to go through every day, moment by moment, finding the strength within yourself, and walking the journey until you reach the very end. So that is the message of hope that I can give to women.
And the hope of seeing tomorrow.
Yes.
So, doctor, as we wrap up this conversation, what would be your take home if there's one thing you could give to our listeners at home?
Early screening, starting with self breast examination once a month, and then doing screening depending on your risk factors, mammograms, and if possible, other tests that are recommended by your general practitioner.
Thank you so much, doctor, for joining us.
Thank you for having me.
Schedule to come and educate and inform us on this very important session. Thank you so much.
Thank you.
And to our beautiful listeners, thank you for taking time to give us an ear. It is a great thing to see a woman coming from diagnosis to survivorship. And as the good doctor has spoken, early detection is key. Let us do the right thing. Thank you.